let me give you a quick behind the scenes look at this course so you can see how it's structured and what you'll learn. As you can see here, we're in our BPPV Exam and Treatment Course. There's 24 modules here, and just like my other courses, I have it set up in kind of a stepwise fashion. So I'm going to give some basic background information, and then typically we'll go into different exam and treatment techniques as needed. So I'm going to go into this first module here. There will be a lecture component, and down here there's different PDF downloadable files that will help support the lecture. So we have PDF slides if you want to print those out and take physical notes or take notes electronically. That's there for you if you need to. And then there's different handouts that will support your learning. Now, if you want to, you can actually just navigate the entire course in this window and go through to different modules or different tests and lab sections as well. So you can navigate the whole thing here if you choose, or as I show you out here, you can navigate it in this window. So I have different modules as we progress through this BPPV treatment. Any of the examination or any of the modules that have testing or treatment, I will have lab components to this. So you'll go ahead, it's not just a lecture course. I will go through each one of these tests or treatments. I will go through them in depth, and I'll talk about the different tips and tricks or clinical pearls, those small things that I find to be very helpful in the clinic to go ahead and help with positioning your patient or going ahead and getting their head in the right position. All these different treatment techniques that really help things be more successful. I'll talk through each of those in each of these one-on-one lab sections of the course. So you'll get a little more in-depth information there. So we'll have examination, we'll have treatments for anterior posterior. I'll give you 3 treatments for them and 3 treatments for horizontal canal. And then after you finish treatment, like what do? What are the techniques that you need to do after you treat BPPV, and what are some things to look for if you're having recurrent BPPV, all right? Just like all my other courses, there will be a post-course test. You will have to get 80% on this test in order to get your CEU credit. Now you can take the test as many times as you need, but you will have to achieve 80%. And then there's a course evaluation form, okay? My hope for this is that if you don't feel competent in BPPV, I feel like I've laid this out in a very systematic and simple way where majority of people find it extremely helpful and they actually get a greater depth of understanding than what they had before. I feel like I explained a complex presentation in a fairly simple way, and I've got a lot of feedback on that was very helpful in people to understand how to treat BPPV where they didn't feel comfortable with it before. So I hope to see you in a class soon, and keep helping those patients.